Alright, so I just got back home. Today is Friday, my 5th day of work this week and my final day of work this week. I was just in clinic all morning. But I don't want to talk about that. I do want to talk about something I've been putting off for a while now. Now, I am not an expert in infectious disease or epidemiology by any stretch of the imagination. That is not my forte. But I am a physician. As of recent events today, I do feel compelled to say that I don't think the US is quite ready or quite prepared to handle everything that's about to come in terms of the COVID-19 novel coronavirus. I don't mean to scare anybody. I just don't think we truly have a grasp on what is yet to happen. A lot of things have unfolded today. Tons of clinics are closing, schools are closing, outpatient facilities are closing, non-emergent procedural areas are closing. We are rescheduling outpatient procedures or non-emergent procedures for up to 90 days now. We have officially locked away all of our personal protective equipment or PPE. They are in an office that no one has access to, and we are only allowed a certain amount of masks and protective equipment at a certain given time, and that is because people will steal them in the hospital. And I want to say this as kind of a public service announcement is do not steal masks from healthcare workers or hospitals if you are visiting there or whatnot. Healthcare workers need these masks to take care of not only the novel coronavirus patients, but also other sick patients as well. And if we don't have this equipment, we can't do our job and take care of patients in a safe manner. And I'm not trying to scare anybody, but I just don't think we are well prepared. And I think we are going to be reactive instead of proactive like we should have been. We have been warned by the Chinese. We have been further warned by the Italian physicians and Italian critical care physicians who basically have told us to get ready, and we haven't. I work at a very large academic tertiary hospital, and we still don't have tests for the virus. So we still, to this day, don't know exactly how many people are walking around with this virus or how many people have been exposed. We have no idea. So I think once our tests become available in my state, I think the numbers of coronavirus patients will skyrocket exponentially. To all the healthcare workers out there, keep being safe. Wash your hands. Wear masks and PPE whenever you can or whenever you're around isolated patients. This is not a joke anymore. It is a serious matter. And for those who think that you're young and nothing's going to happen to you if you get infected, yeah, probably true. Statistics say that the young people will probably have just a minor illness and move on. However, that's being a little bit irresponsible because when you are young and infected and carrying a very contagious disease or contagious virus, you can transmit it to anybody along your path or anybody you come in contact with, a patient who is elderly, a patient who is immunocompromised, a patient who is immunosuppressed, or any of the above. And let's not forget, you may come in contact with a 30-year-old with cystic fibrosis or a 25-year-old who is on immunomodulator drugs for their Crohn's disease, and these patients can be immunosuppressed or can have really poor outcomes if they are exposed to this virus. A cystic fibrosis patient who is exposed to this virus can be put over the edge very quickly, and it is not a joke. So please wash your hands if you are exposed to the virus. Do not go anywhere. Quarantine yourself, follow the rules, follow the guidelines. You do not want to spread this virus to people who can be affected very poorly by it. I don't want to beat a dead horse because so many people have talked about this before, but I feel like I should do my part as a physician and give this kind of public service announcement. Again, I'm not trying to scare anybody, I'm just trying to inform people and make them a little more aware if they're not already. Leave a comment below if you have any questions, I will try to answer them. Make sure you smash that like and subscribe button. Follow me on Instagram, turn on post notifications so you are notified when I post a new video, which is usually about once or twice every week. Otherwise, I'll see you all on the next video.
Hello, my name is Jyoti. As we know that there was an evacuation plan for the Indian people in Wuhan to go back to India. Yesterday there was a first flight and me along with my colleagues, 58 members, were supposed to take the flight. but I couldn't take the flight along with one of my colleague because we had a high body temperature, a bit raise in a body temperature, and we were asked to stop and not to take the flight. They said that we can take the next flight, but today at the afternoon they called and said that we are not even allowed to take the flight because of that yesterday's body check and a bit high temperature. In our entire batch, only we two people are left behind. With we are struck. We the Chinese people didn't assure neither deny that we are having any virus. We here like we are ready to prove that we don't have any virus because we don't have any symptoms. We had just a raise in our body temperature. It was not that high. It was just some 37.5 degrees, which was because of due to some physical activities and some strain at that time, and due to we were panic a bit, but the temperature now is stable and we don't have any other symptoms regarding this coronavirus. So we request our government to take us back to India, and for that we are ready to prove ourselves that we don't have any symptoms or symptoms regarding the virus, and we are safe and healthy. So I request the government to take us back to India. Thank you.
Guys, I can stay at home. I want to check true or not true about the store what German is panic and they buying all it what they can find on the store. True or not, just right now we checking, because in the Italy I heard it's really true. In Italy right now we have 9,000 people infected. In Germany 1,200. I visited Kaufland, the most biggest store in the Germany. It's a 1 hour because real it's have a second position, but Kaufland it's still big. If you live in the north, real it's more popular. In Berlin it's Kaufland, and right now I just want to check it's true or not what people in the Germany start to buy and everything what they can find in the store. It's like muesli and all of it is full, like how you can see. Spaghetti is full because these things bind in the first. It's a lot of meat also. Look at how many drinks here. All of it is full. And the last thing what they usually buy it's a tomato noodle pasta and something else like. But all of it's full. And what interesting, I think right now product in the store really more than usually, and I think store will be ready for this scenario if people go in the store and start to buy all of it what they can find. I'm the one of our most expensive district in the Berlin. In this district it's really clean. This district looks like Charlottenburg, but price in this district like Mita and even more than price in Mita. Insane guys. It's a little bit cloudy when I leave my home. It was a little bit warm and don't have even have a rain. Interesting thing about this building, they have a really huge history, and I think that it's one of the most interesting places in Berlin if you want to visit it. This building looks really strange because they have because this thing looks like, I don't know, like Chupa Chup. How I remember this building had a nightclub, cafe, restaurant and many different things, but I'm not sure what it's right now to really work. Look at guys, I walk in the street and what I will see. It's a special Easter market. It's interesting because only after 1 month will be Easter. Today I plan to go on the district Spandau also, but I think I don't because heavy rain outside. It's uncomfortable for the walking. I think for the next time. Also here in Spandau you can find castle, but I'm not sure. And right now I'm planning to go. It's a new day. Yesterday I planned to go on the Copenhagen, but the weather yesterday was really bad. But right now, plus 12, it's really nice. And today don't have a rain, it's pretty good. And right now I'm going on the Copenhagen and I want to see some interesting place. Of course for me it's interesting. I go afternoon because I learning English and every day I try to learn. I'm here, guys. I'm the district Copenhagen. I'm not sure how I can correct say that. This district looks a little bit different, like old Berlin. I think it's more like Hamburg. And also, I want to live in this place, but you need to spend more time for the going on the center Berlin. But plus, in this district have many parks, many rivers. Not cool. It's really comfortable if you want to turn on the left or turn the right. You can see what is on the egg. It's all of it for the comfort though. I know it's a little bit vandalism here, but it still works and it still can save your life, you know. Köpenick Palace. It's a castle who have around this territory sea or river, I don't really know. If you choose a district for the living in the Berlin, this district looks like another small city in the Germany, but this district on the Berlin, it's a big plus for you. And the last thing what I want to show in the Copenhagen, I will go in on this place right now. It is the place what I want to visit it. Looking at the view behind me, it looks really awesome, and here you can see not too big park. How I can understand, it's a really expensive place because around here you can see many expensive ships. Before I finish this vlog, I want to say coronavirus in Germany, it's something insane because for today we have about more than 3,000 infected people. The day before was only 2,000. I'm a little bit scary because it's too fast. Right now in Italy they have about 15,000 people who ill in coronavirus. Italy is too near with Germany, and in Berlin cancelled all event who have more than 1,000 person, and also children stopped to teaching in the school for the 20 April, about 1 month. And right now you can see how many people ill for date when I publish this video. And guys, let's finish up to 1,000 subscribers on this YouTube channel. I know you can help me, and only with your help I can do it. Anyways guys, don't forget to subscribe on this YouTube channel, take a thumbs and write in your comments. It was TV Brain, and see you in the next video. Bye.